If you manage febrile neutropenia on the inpatient oncology service, this one is a must-read. Here's why it matters. Why this is important. The last major ECIL update on empiric antibacterial therapy was in 2011. Since then, antimicrobial resistance has escalated dramatically, particularly among gram-negative pathogens. Key takeaways for oncology hospitalists. One personalized empiric therapy, not one size fits all. Empiric antibiotic selection should be driven by local resistance patterns, prior colonization/infection history, and clinical severity, not just reflexive broad-spectrum coverage. 2 monotherapy is still the standard for stable patients, reserve combination therapy, and carbapenems for critically ill patients, those colonized with resistant organisms, or high-resistance prevalence settings. 3 new options for resistant organisms. For the first time, ECIL formally incorporates cifidrocol and novel beta-lactam/beta-lactamase inhibitor combinations into the treatment algorithm for patients at risk for resistant gram-negative infections. 4. Persistent fever not equal to automatic escalation. In clinically stable patients with persistent fever, the recommendation is to continue diagnostic evaluation and consider non-bacterial causes and not to reflexively broaden antibiotics. 5. Antibiotic discontinuation regardless of neutrophil count. This is the big one. ECIL-10 recommends fever of unknown origin. Stop antibiotics after greater than or equal to 72 hours of therapy if Afbrel greater than or equal to 48 hours and hemodynamically stable, regardless of neutrophil count. Documented infections. Consider stopping after completing the intended course if Afbrel greater than or equal to 72 hours, clinically stable and infection resolved, regardless of ANC 6. De-escalation is not optional. Once resistant organisms are excluded, de-escalate to narrower spectrum agents. 7. Stewardship is the overarching theme. Every recommendation is framed through the lens of antimicrobial stewardship. Use combinations only when warranted. De-escalate early, shorten durations, and stop when appropriate.